I need to ask you something important, right now. What if the number your doctor calls normal is actually putting you at risk? I know that sounds hard to believe. You go to your appointments, you take your medication, you do everything right. But here is what most people never get told. After the age of 60, the blood pressure target that once kept you safe might now be quietly working against you. Let me tell you about a patient I want you to think about. Her name was Margaret. She was 67 years old, sharp mind, active lifestyle. She walked 2 miles every single morning. Her doctor looked at her chart and said, "Your blood pressure looks perfect. Keep it up." 6 weeks later, Margaret collapsed in her kitchen. Not from high blood pressure, from the opposite problem. Her numbers looked fine on paper, but inside her body, something very different was happening, and nobody caught it. Stay with me today, because what I am about to share with you could be one of the most important things you hear this year. Now, before we go any further, I want to be very clear about something. High blood pressure is dangerous. That part has not changed. It raises your risk for stroke, heart attack, and kidney damage. Those risks are very real. But here is the problem that does not get nearly enough attention. For adults over the age of 60, getting your blood pressure too low can be just as dangerous, sometimes even more so. We have been told our whole lives, lower is better. Keep it under control. Push that number down. And for younger adults, that advice makes sense. But your body at 65 is not the same body you had at 40. Your arteries are different now. Your brain is different. Your circulation is different. And the same aggressive treatment that helps a 45-year-old can actually harm a 70-year-old. Here is what I see more than you might expect. Older adults who are doing everything right, eating well, exercising, taking their medications, and still feeling dizzy when they stand up. Still feeling foggy in the afternoons. Still exhausted after a short walk. They ask their doctor about it, and they are told, "Your numbers look great," but their body is sending a completely different message. And today, I want to help you understand what that message might mean. Let me ask you something personal. Have you ever stood up from your chair and felt the room spin for a moment? Have you ever felt a strange heaviness in your head after taking your morning medication? Have you ever had a stretch of days where your thinking felt slow, clouded, off? If your answer is yes to any of those, please do not brush it off as just getting older. Because here is what many people do not realize. When blood pressure drops too low in an older adult, especially the top number, your brain starts to run low on oxygen. And your brain does not handle that quietly. It gives you signals, small ones at first. Dizziness, fatigue, brain fog, blurry vision, cold hands and feet. These are not random symptoms. They are warning signs. And here is what makes this so dangerous. These symptoms are easy to miss. They come and go. They are gradual. They feel like just aging. So weeks go by, sometimes months, and all that time, your brain is getting less blood flow than it needs. This is not a rare situation. This affects millions of older Americans right now, and many of them have no idea it is happening. That is what I want to change today. For decades, the gold standard was 120/80. Systolic over diastolic. The top number over the bottom number. Medical schools taught it. Doctors repeated it. It got printed on millions of pamphlets. But here is something important to understand. That number was based mostly on studies done on middle-aged adults, many of them under 55. It was never meant to be a one-size-fits-all rule for every person at every age. As we get older, our arteries naturally become a bit stiffer. The heart has to push a little harder to move blood through the body. So for many older adults, a slightly higher top number, somewhere between 130 and 145, is not a sign that something is wrong. It may actually be your body doing exactly what it needs to do. Your body is not broken. It is adapting. The question is your treatment plan adapting with it? Here is the part I really need you to pay attention to. When the top number, your systolic pressure, drops below 110, your brain may not be getting enough blood. I will give you a simple image to hold on to. Think of a garden hose. Too much pressure, and the hose bursts. Too little pressure, and the water never reaches the flowers at the end. Your brain is those flowers. It needs a steady, consistent supply of blood every single minute of every single day. Let me tell you about a man named Ronald. He was 72, a retired firefighter, strong, independent. His doctor adjusted his blood pressure medication, wanting to push that top number down aggressively. Within 3 weeks, Ronald started falling asleep in the middle of conversations. He forgot the names of people he had known for 30 years. His family was terrified. They thought it might be the beginning of dementia. It was not dementia. His blood pressure had been pushed too low. His brain was running on reduced oxygen. When the medication was adjusted, Ronald came back. Within a month, he was himself again. That story is not unusual. It happens more than most people realize. There is a medical term I want you to remember: orthostatic hypotension. I know that sounds complicated, but the meaning is simple. It means your blood pressure drops suddenly when you stand up. You have probably felt it, that quick dizzy spell when you get up too fast, that brief moment where everything tilts. For younger people, the body corrects this in just a second or two, but for adults over 60, that correction slows down. And during those extra seconds of low blood pressure to the brain, falls happen, fractures happen, emergency room visits happen. Not because of a heart problem, simply because someone stood up and their body was not ready. 1 in 3 adults over 65 will fall this year. Blood pressure drops, especially in the morning and after meals, are one of the leading contributing factors. If you have had these dizzy spells, please tell your doctor soon. Let me give you the most up-to-date picture I can. Medical understanding of blood pressure in older adults has changed significantly in recent years. Today's guidance from leading cardiovascular health experts looks something like this. For adults between 60 and 75 who are in generally good health, a target around 130/80 may be appropriate. But only, and this is important, only if it is well tolerated. For adults 75 and older, or those managing multiple health conditions, a systolic pressure of 140/150 may actually be the safer range. And for older adults who are frail or who have a history of falls, aggressively lowering blood pressure can sometimes do more harm than good. Notice that phrase I keep using, if well tolerated. That phrase is doing a lot of important work. It means the number on the chart is only part of the story. How you feel matters just as much. Even if your doctor says your numbers look fine, your body might be telling a different story. Here are 5 signs to watch for. Sign number 1, dizziness when you stand up. If this happens more than once a week, it deserves a conversation with your doctor right away. Sign number 2, unusual fatigue after light activity. Not the normal tiredness of a busy day, a deep, heavy, dragging exhaustion. Sign number 3, blurry vision in the afternoon. This can be a sign that blood flow to your brain is lower than it should be. Sign number 4, mental fog or trouble concentrating. Many older adults are told this is just aging. Sometimes it is not. It may be blood pressure. Sign number 5, cold hands and feet even in a warm room. This can signal that your circulation is being affected. If 2 or more of these sound familiar to you, please write them down. Bring that list to your next appointment. Do not assume it is nothing. Do not wait. This is something I feel strongly about. Many older adults are taking 2, 3, sometimes 4 blood pressure medications at the same time. Each one was prescribed for a good reason at the time. But here is what often gets overlooked. The person who received those prescriptions years ago is not the same person sitting here today. Think about a woman named Dolores. She was 74. She had been on the same blood pressure combination for 9 years, but in those 9 years, she had lost weight, improved her diet, started walking regularly. Her health had changed quite a lot, but her medication had never been updated. So the drugs that once matched her body were now pushing her blood pressure far lower than it needed to go. The lesson here is simple but important. Your medication needs change as your body changes. A prescription that was right at 65 may need to be adjusted at 74. So please ask your doctor this question. Is it time to review my blood pressure medications? That one question could make a real difference. Here is something empowering I want you to hear. You do not have to wait for a doctor's appointment to understand your blood pressure. A reliable home blood pressure monitor costs between $25 and $50, and the information it gives you can genuinely help your doctor make better decisions for you. Sit quietly for 5 minutes before you take a reading. Movement and stress affect the numbers. Take readings at the same time every day. Consistency matters. Check both morning and evening, because blood pressure changes throughout the day. Write down your readings in a simple notebook and bring that log to your next appointment. One high reading is not a crisis. One low reading is not an emergency, but a pattern over days and weeks. That tells the real story, and your doctor needs that story. Let me bring all of this together for you. Here are 5 practical steps you can take, starting right now. Step 1. Learn both your numbers, not just the top number. The bottom number, diastolic, also matters, especially for adults in their 50s and early 60s. Know what both of yours are and write them down. Step 2. Ask your doctor for your personal target, not the textbook answer, your answer. At your next appointment, say exactly this. Given my age and my health history, what is the right blood pressure target for me? You deserve a specific answer to that specific question. Step 3. Never stop your medication on your own. I want to be very direct here. If you believe your medication is making you dizzy or causing symptoms, please do not stop it without guidance. Stopping blood pressure medication suddenly can be dangerous. Talk to your doctor. Ask about a gradual adjustment. There are safe ways to make changes. Step 4. Stay active, but be careful about transitions. Exercise is one of the best natural regulators of blood pressure. Walking, swimming, gentle resistance training, these all help. But rise slowly when you get up. Warm up before any activity. Give your cardiovascular system the time it needs to adjust. Step 5. Do not over-restrict your sodium. Many older adults cut sodium drastically because they have been told it is dangerous, and for some people, that is the right approach. But very low sodium diets can actually contribute to low blood pressure in older adults. Balance is the goal, not elimination. Talk to your doctor about what is right for your specific situation. I want to bring you back to Margaret one more time. After her collapse, her doctors looked more carefully. They discovered that her blood pressure had been dropping dangerously low every single morning, right around the time she went on her walk. Her medication, combined with mild dehydration after sleeping, was pushing her systolic number down into the 90s. Her chart said she was fine. Her body at 6 in the morning was in crisis. She recovered fully. She is doing well. But it took a collapse on her kitchen floor to get anyone to look at the full picture. I do not want that to be your story, so I need you to hear this clearly. You are not a number. You are not a single reading taken in a doctor's office once every few months. You are a living person whose body changes over time and whose care should change with it. The right blood pressure for you is one that protects your heart, feeds your brain, and keeps you stable on your feet in the morning. That is the number worth knowing. That is the number worth asking about. Before you close this video, I want you to write down one question. Just one. Doctor, what is the right blood pressure target for my age and my health today? And is it time to review my medications? Write it on a sticky note. Put it on your bathroom mirror. Take it to your next appointment, because you deserve more than a number that looks good on paper. You deserve answers that keep you healthy, keep you clear-headed, and keep you living the life you have worked so hard for. If today's video helped you, please share it with someone you love, a parent, a spouse, a friend, a neighbor. It might be exactly what they needed to hear. And if you would like to know the 5 foods that naturally support healthy blood pressure after 60, that video is right here waiting for you. Take good care of yourself. I will see you in the next